Good evening. So, welcome to yet another session of AMA Ask Me Anything. Great. So, these sessions happen every Tuesday at 9 p.m. Ask Me Anything weekly sessions, and this is our 70th one. Okay, so these, as you see, these sessions happen every Tuesday at 9 p.m. on my YouTube channel. Okay, so today we have come with another topic, that is the relationship between the doshas and the dushyas. Dushyas is something which probably many people would not have heard. I'll come to that and try to explain what it is. Okay, so let us go through it. So relation between doshas and dushyas. Yeah, Tejeshwara, good evening. Okay, so what are doshas? All of you would have heard the three doshas, the Vata, Pitta and Kapha. Okay, so that is the basic foundation on which the Ayurvedic principle stands, the Tridoshas. So the relationship between the doshas, that means the Vata, Pitta, Kapha and the Dushyas. So Dushyas might be a new word for so many people. Many people, I'll try to explain what the Dushyas are. Okay, so Dushyas are basically 10 in number. Okay, we'll see that. So what are the dushyas? Dushyas are the seven dhatu, the rasa, rakta, mamsa, meda, the tissues we call that, okay. Rasa, rakta, mamsa, meda, asthi, majja, shukra. And the three malas, the excretory products, the mutra, the urine, purisha is the, excreta, and sweda is the sweat. So mutra, purisha and sweda. So these 7 plus 3 put together is called the dushyas. Okay, so the relationship between the doshas and the dushyas. Now, for that you should understand what the doshas. Many people consider, dosha means something really bad. Okay, so let me try to explain what doshas are. Okay, here you are. Doshas are that which can lead to imbalance. Okay, so when the doshas are in balance, Vata, Pitta and Kapha. Okay, Vayu Pittam Kabas Chedi Trayodosha Samasata Vikrita Avikrita Deham Granti Te Vartayanti Cha. So what happens is when the three doshas are in balance, they maintain health, and when they go off balance, they can create an issue. So doshas are not the thing which can actually create an issue. They are capable. Doshas are the one which can cause an imbalance, and that is the reason why dushyanti, they can cause imbalance. Okay, they are not the real problem. So those which can create an imbalance for the doshas, and dushyas are the one where the imbalance is actually created by the doshas. So when you have got the dosha in certain dushyas, okay, then there is this effect, the doshas on the dushyas. So the doshas actually affect the dushyas, and then they create the imbalance. So knowing this is very important as far as Ayurveda and as far as Ayurvedic practice go. Okay, now this is called ashraya bhava. One lives in the other one. Okay, they're basically interrelated. So ashraya bhava, they are related to each other. They are dependent on each other. That's what we call as it. The ashraya bhava, the one that is dependent and the one which helps the other one. Both are interrelated. Okay, ashraya bhava. That's what we call ashraya bhava. Okay, so if you look at all the 7 dhatus and the malas, in the asthi or in the bone, in the tissue of the bone is where the vata is. Okay, and pitta is in the sweda and rakta. Pitta is in the sweat and in the blood. Okay, and kapha in all the other ones, in the sense, in the muscle, in the fat. Okay, in every other thing, it is basically if you go to the previous slide, you can see what all things are there. Okay, where is it? Look at that. In rasa, mamsa, medas, majja, shukra. Okay, in mutra and in purisha, in all these things you have got kapha. In asthi you have got vata, and in Rakta and in the Sweta you have got the um, Pitta. So how does it basically work? Okay, these are the relationship. Now, what is basically the relationship? How it works? So look at this. It's very clear here. When in all other things, okay, it is not Veda, it is Sweda. Okay, so when Vata goes up, when you look at in Pitta and Kapha, let us look at that first. In Pitta and Kapha, okay, when Pitta goes up, the Sweda and Rakta, it's not Veda, it is Sweda. Okay, S is missing there. It's been covered with that arrow mark. Sweda and Rakta goes up. Okay, when Pitta is goes up. When Kapha goes up, all the remaining things go up. So when Pitta goes down, the quality of Sweda and Rakta goes down. When Kapha goes down, all the remaining things will also go down. But it is opposite in Vata. When Vata goes up, the quality of Asthi goes down. Or when Vata goes down, the quality of Asthi goes up. You can notice that, as a person ages, he gets into the Vata age. So when that means the Vata is slowly increasing. You'll notice that when the Vata is slowly increasing, the quality of his bone goes down. That's when you say the bone density is bad, osteoporosis, osteopenia, lot of things come affect the bone. That is because the Vata is going up. As the Vata keeps on going up, the quality of the bone keeps on going down. Okay. But in Pitta and Kapha, it's opposite. When the Pitta goes up, the sweat, the quality of the sweat and the blood goes up. When the Kapha goes up, all other things go up. When Kapha goes in, all other things go down. So this is basically how the relationship with the doshas and the dushyas are there. And this is what we use for diagnosis and for treatment. Okay, so when we notice that the muscle is going down, okay, the mamsa is going down, we know that the kapha has gone down. Okay, so we do everything to increase the kapha, and when that kapha is increased, that muscle slowly starts going up and it starts getting better. So when the quality of the bone goes down, we know that the vata is extremely high. So we do everything to bring the vata down. So what happens? Slowly the quality of your bone goes up. Okay, so this is how it is related. So this is very important for us, especially for practitioners like us. It is very important. I don't know how important it is for you to understand, but this is a relation. And so dosha samurchana, we call that. So when the doshas are affected, when the doshas actually go out of control, we call that. So that is what the treatment is also. You should understand what has created it, what dosha. So when the effect is in the blood, we know that it is pitta that has been affected. When you've got a problem with sweat, we know it is pitta that is affected. When you have a problem with muscle or fat or with, it can be with your marrow or anything, we know that it is the kapha that is basically being affected. If you're not passing motions really well, we know that your kapha is low. That means you're not passing more. The vata has gone up. So we have to bring that kapha up to see that you pass motions really well. Okay, so this is extremely scientific for you. I don't know how well you're able to grasp it, but somebody who is practicing will be able to understand that this is what this is the relation between dosha and dusha, and this is how we manage it. Okay, so you can start asking your questions. Okay, people have already started asking questions, and let me try answering them. Yeah, Tesha, good evening. Okay, now let me see. Madanalambika. Eating twice is okay. Will the proper diet is maintained if you take 3 times sufficient food is balanced? I don't understand your question. Is eating twice okay? Was your question, right? I would say, if you are somebody who is mostly at home, like for example, you're working from home and not going out too much, traveling early in the morning by about 8 o'clock for work and then coming back. All those people, I would say, because travel and all other things can increase your vata up, I would say eating thrice is also fine. Okay. But if you're relaxed and you're at home, eating twice is also more than enough. If you eat that balanced food and you do moderate exercise and sleep really well, you are definitely going to be healthy. Absolutely no problem, because eating twice is more than enough. Does high pitta cause loss of appetite? That's a good question. You should understand 2 things are there. Okay. Agni, or the digestion, is basically pitta, And one major difference between the quality of Pitta and Agni, okay, even though both are the same, is that Pitta has got the quality of Drava. That means it is liquid. It does not flow. It is ready to flow. Okay, so it is liquidish. But the Agni in the tummy is devoid of that liquid property. It is solid. Okay, so when Pitta goes up, when the quantity of Pitta goes up, that's what I'm trying to tell you. When quantity of Pitta goes up, that means Pitta, which is supposed to be in the gut, in the koshtha, it quantity increases. That means which was solid has becomes liquid, and it goes out of the gut. So when there is an increase of quality of pitta, your appetite goes up. But when there is only an increase in the quantity of pitta, the pitta which is supposed to be here has gone out, your appetite will go down. So it depends upon whether the quantity is gone up or the quality is gone up. When the quality goes up, your appetite goes up. When the quantity goes up, your appetite goes down. Cynthia, if kapha increases a lot, doesn't it possibly create extra unwanted mass such as tumors and fibroids? See, when kapha actually increases beyond a limit and it is not in balance, then yes. Otherwise, we also need kapha for maintaining this body, right? Kapha is the solid form of what we feel in our body. Everything what we feel is because we have got kapha in it. Kena phaliyati iti kapha. You are living. The essence and the nutrition is all kapha. So you need kapha for existence. But when it goes very high, and then when you have got vata acting on it, that's when it solidifies. Okay, Cynthia, if vata is not acting on that increased kapha, you'll see a lot of people with a lot of kapha and a lot of fat and all those things, but they need not have tumors. But when there's an imbalance and focused vata acts on the kapha and solidifies it, then only it will lead to tumors and or fibroids. Okay, so just increase in kapha will not cause a problem. But if there's a clear imbalance and vata starts acting on that imbalanced or increased kapha, then you'll have a problem. Okay. Yeah, Priya, good evening. Krishna, does high pitta and vata create vitamin deficiencies? See, when things go out of balance, Krishna, I'm telling you, vitamins are again a part of your nourishment. Okay, when your vata really goes up, that means what? You are slowly getting denourished. Your body is getting dry. That means your nourishment of the system is going down. I don't want to specifically say vitamins. Okay, your minerals and everything will go down. Okay, and if your pitta goes up, if your vata and pitta goes up at the same time, 100% you'll have more imbalances. Okay, because it is dryness plus heat going up. But if your pitta is actually balanced, okay, and your vata is going up, then it's slightly better. But pitta has to be balanced for your food to get digested and to get absorbed. So if you see that your food contains that kind of nutrition, like minerals or vitamins or whatever it has to get digested and absorbed, right? So if your pitta is really high and you're not digesting the vitamins what is there in the food, or even if you take vitamin pills also, those are not going to get absorbed. So your agni has to be balanced for proper absorption to happen. Okay, and vata can't go very high up. Not good. You get denourished. Spiky pine. Okay, you have got Shivaji's DP. Namaste, doctor. What could be probable cause of inflammation and infection of the umbilicus, and how can we cure it? If you look at the umbilicus, it is basically the juncture of pitta and vata. Okay, if you draw a straight line between the umbilicus and the heart, okay, between the umbilicus and the heart is pitta. Below the umbilicus is vata and above the heart is kapha. So umbilicus specifically is the juncture of vata and pitta. Okay, and below that umbilicus is where the grahani is. The what we call that, the duodenum sort of thing, which is the sthana of pitta. So any inflammation in the umbilicus is basically because of pitta. So you have to see, it depends upon what kind of inflammation is there. Okay, so it could be coming from within, or it could be something which is also external. If it's only in the umbilicus, from external thing. But if it is coming from within, then the treatment is different. I think it will be always good for you to consult a doctor. Okay, pitta has to be brought down, is what I would say initially. The pitta has to be completely brought out. For that, anything where you pass soft bowels and get the pitta out of the system should be the first line of treatment. Then it depends, whether we should give you drakshadi kashayam or manjishtadi kashayam. Those things are different. But getting that pitta out of the system by seeing that you pass soft bowels or virechana would be the first approach, Spikey. Let me see where. Tejas, how to increase quality of pitta? Okay, generally speaking, everybody will have a little bit of pitta. Okay, vata, pitta, kapha in different proportions. So you need not basically look at increasing the quality of pitta. You don't have to focus on that. I would say if you don't indulge in activities, your lifestyle activities or food or whatever it is, where you will disturb your agni or your digestion too much, that is more than enough for your pitta to be active. Okay, like you don't suppose you don't overeat when you're eating, you don't eat wrong kinds of foods, and you don't exercise at all, you stay awake late at night, and you probably might be consuming too much of alcohol very frequently, too much of spicy food, too much of salty food, too much of sour foods. All these things can actually disturb your digestion and your agni. And when your agni and your digestion is disturbed, definitely the quality of pitta goes down. So you don't have to be bothered about how to increase the quality of pitta. Don't think about it. If you are living a basically balanced life, the pitta, which your innate pitta, will always have good quality. Okay. Yeah, welcome. Recently, I've come across posts that mention that tumors in the body is body collecting and locking up the toxins. So it's not a good thing to cut it open now. But what's your take on this? See, a lot of things I also see on social media about that, which I am not very sure about it. But still, I would say, if there is a tumor or something which is silently lying down there, it is not the I don't want to say that the body is purposefully trying to lock everything and keep it. It so happens that a lot of things get blocked and it stays inside. And there are a lot of studies which also say that if to take a biopsy, if you uh, prick it and take a part from inside, there is always a chance of whatever is there inside the tumor probably getting activated, and then it can cause a lot of problems. There is always a saying in English, right? What you would have heard this, let sleeping dogs lie. You don't want to see whether the dog is actually asleep or not. If it is sleeping, let it sleep. You don't want to meddle with it. So the same thing applies here also, but there are no conclusive studies about it. But there are still a lot of people who say as long as you don't poke it for biopsy, it might not progress too much. And people say that because of the poke for biopsy, it progressed. So nothing conclusive, but it's actually a right point where people are doing a lot of studies. Last week I learned about eating cooked fruits. I tried it in the whole week and now no going back. Thank you for educating us. Oh, okay, Priya. Yes. Good. Somebody is actually putting things into use. We mostly in Kerala, in bananas, we every day in the morning I have, we get that big bananas. We call that Nendram banana, a big one. Half of the banana I have it every day in the morning along with my breakfast. I don't want to say addicted to it. It's become a part of my lifestyle. Okay, yeah. Yes, Hem Vaidya, good evening. How to clean our lungs due to air pollution in Bangalore? Tejeshwara, I'm very sorry that you are not in a nice place, Bangalore. First thing is that, Ayurveda says, Nidara Parivarjanam. Even if I clean, okay, you come to Kerala, you stay in a hospital for about 2 weeks, 3 weeks. We do a lot of treatment. We clean your lungs and leave you. Are you still going back to Bangalore, or are you going to a cleaner place? That's the first question you have to ask yourself. So Ayurveda believes in Nidana Parivarjanam Chikitsa, removal of causative factor. So first of all, if you can stop, even if you don't do anything, I'm telling you, even if you don't do anything, you move from Bangalore to some other place where there is little to no air pollution, your body will automatically cleanse a lot of things. But when you do the treatment, you can make it more effective and you can fasten it, speed in it a little bit. But otherwise, I would say you still being there, you cleansing and going back there, in my opinion, doesn't make sense. Okay. What do you say? My daughter often facing cold and irritation in the throat. How to maintain proper smooth function in nostril and throat? It depends upon your daughter's age. I'm telling you very clearly. If your daughter is might be about 8, 9, 10, 11, till 8, 9, 10, it is kapha season, kapha age, and the kids are prone to cold, cough, running nose, fever, and all those things because they are in the kapha stage. Okay, and there you can see the kapha is the one that makes them grow. And as they are growing, and by the time they reach 12, 13, okay, you'll notice that there'll be a huge change in their body. Their periods will start, hormones, the hot hormones will start coming, and the heat of the body goes up, the sweat will start smelling. All those things are changes in the hormone. Once they enter the pitta stage, you'll notice that suddenly, or over a period of time, you notice that no cold, no cough, no asthma, lot of issues will settle automatically. So if the child has got certain small breathing issue and all those things, I would recommend you to not give them with steroids or puffs and all those things, so they get used to it. Because as they age, they might actually get stronger and they might find resistance to all those things. But if they're used to all these things, they might carry those to adulthood also. Okay, so I would say steam inhalation would be a very good option, or probably seeing that their lifestyle, see that not exposed to too much of cold, not eating ice creams or excessive curd or too much of fruits in the evening, and all small things. If you can make changes, Ambika, I would say that she would be better. Okay. Yeah, thank you. Hey, if there is a frequent food poisoning after every few months, what can be done? I think if it is food poisoning, then probably you might not be eating at the right place, because the food contains things which are not good for human consumption. Okay, but otherwise, eat anything can cause a stomach upset. Probably eating outside would not be a good choice, if I'm right. Okay, always. If you're a bachelor, you're working somewhere, and you are always dependent on outside food, Krishna, I would say it's not very good for your health. Okay, what can be done? I would say, when I travel, I always carry tablet called Vilwadi Gulika. Okay, Vilwadi Gulika. It is mentioned in Ashtanga Hridaya, and it is good for all kinds of poisonings, especially insect bites, wasp. You don't know what can bite, what can bite you. You can even for scorpion poison. Recently, when I was in the US, we had cases where the scorpion bit a person. Immediately, Vilwadi Gulika internally and Vilwadi Gulika mixed with tulsi leaves and apply externally. Okay. Or if you feel that you have not taken something good, you feel that you might get a stomach upset or food poisoning, Vilwadi Gulika works wonders. Okay. But I would say stay away from the place where you're eating. Food might not be very hygienic. Hello, 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 Rudo. Finding out one's Prakriti seems to be a tedious task. Is it really necessary to find out, doctor, or we can just leave it and focus on good food and food? I would say you don't have to do too much. Okay, you just be in sync, or I would say uh, be conscious about what is happening with you. You'll know that what are the foods that make you feel better, or what are the foods which upset you. Okay, it is not that everybody knows their prakriti and they're living according to their prakriti. You probably I would say you stick to traditionally available foods, eat that really well, sleep well, do decent exercises, and stay healthy. You don't have to know your prakriti to be healthy. Okay. Clear. But if for me, if you're sick and you come back, I'll have to do all those things to basically get your balance back. But you don't have to know any of those things. Okay, just follow your instincts or your, whatever you feel like doing, and don't overdo things. That's all. When to drink water, before, during, or after meal? Okay, Ashtanga Hridaya says this very, very, very clearly. Okay, you can drink water before, during, and after food. Okay, any just like any activity will you do will actually give a result. Okay, so according to Ashtanga Hridaya, if you drink water before food, what will happen is, it says, you will not be that nourished. If you drink water after food, your nourishment will be more than normal, and if you drink water along with food, your nourishment and will be balanced. So you can look at another way. Okay, suppose before sitting to eat food, if you drink 2 glasses of water, the amount of food you consume will be slightly lower. Okay, so over a period of time, you'll slowly get denourished and you might lose weight. Okay, and if you're drinking water along with food, water and food goes in balance, and then you're maintaining. Okay, and if you drink water after food, that means you're filling your whole stomach with food and drinking a little bit of water. So that means the whole space is taken up by food. You will be well nourished, or there's a chance of you putting on weight. Ashtanga Hridaya says this very clearly. And of late, when we were in college, we used to see that they say, should not drink water before food, it will dilute the acid. Now science have said that that's a myth. Okay, we never created the myth, they only created, and they are busting it now. Okay, and they say, how much of water you drink, the pH of the stomach, it knows how to balance itself. So as I said, when you drink the water, it gives out a different result. Pragati Madan, Namaskaram. We have heard that Ayurveda doesn't recommend raw salads and with cooked food. Shall we totally avoid eating simple green lettuce, cucumber, onions, or can we have it half an hour before food? It says, both have got different paka. In the sense, cooked food and uncooked food have got different, they need different digestive capacities. So don't mix is what Ayurveda says. But I would say, if you want to, but it does not, but that doesn't mean that you should completely avoid. I would say eat your salads first. Okay, and then continue with your cooked foods. I'm telling you, don't mix and eat. Okay, you have your salads first, then you continue with your cooked foods. But generally speaking, I would recommend people who have got problems in digesting. I would say, if you want to eat that salad, you can still steam cook that salad a little bit and have it, so that it gets digested pretty fast. See what suits you. Okay, because these two things, one is cooked and one is uncooked, since these two needs different digestive capacities to digest it, Acharya says don't mix it. Okay, but you can have one, then you can follow the other one. Have your salads first and then follow that with your normal dinner or lunch. Okay, could you write down that? What was that? You mean I had mentioned the name of only one tablet which works for poisoning. If that is the one, I'm typing it down. Okay, Vilva the Kulika. I've typed it. Hope it comes there. Yes, if that's what Cynthia you wanted. Elsia and Anya Adventures. Wow. What are the reasons for cravings for sugar? Couple of things. One is habit. Second thing is that your body is sometimes using up. You are into a job or something where you are extremely stressed, tensed, anxious, where you're using up a lot of your brain is using up a lot of glucose, and suddenly you feel drained out, and you want, and when you're drained out, you feel like naturally you directly go to eat something sweet, so that your body can replenish that used glucose. I would say if you feel like having, this is something where you have to get disciplined. Okay, nobody can help you if you have got that craving and you keep on going back to that craving. I would say it's a decision which you take that I will not eat, and whenever you feel like having that sugar, you go out for a walk. You go for a brisk 10 minutes walk, you'll notice that your craving goes down because we have, all of us have got stored glucose. The body immediately releases that. Body is also looking for shortcuts. If you can give it from outside, good. If you don't give it, body will definitely release it. And rash on the skin as soon as high sugar intake is probably because your pitta is getting imbalanced. Okay, when your kapha goes up, especially you will get a lot of rashes when your kapha goes up. We call that shita pitta. Suddenly rashes might come up. Okay, that is because your body is not being able to, uh, you know, metabolize that extra sugar. And I say it is not a nice thing for you to do. Long term, after a point of time, it might lead to other metabolic issues also. So control yourself is the only thing I can tell you. Elsia and Anya. Okay. Personal discipline. My daughter's 25 years and she's staying in a very neat place, but sometimes comes in contact with many people and suddenly catches cold and cough. Okay, then probably her immunity might be slightly on the lower side. Okay. I would, as I always tell people, food on time, good food on time, sleeping really well, and decent physical activities will keep you away from lot of infections or diseases also. So see if your daughter is actually doing these things: sleeping early and sleeping really well, eating good balanced food on time, and doing moderate exercises. In spite of doing all these things also, if she falls sick frequently, then I would say it's time for you to consult a good Ayurvedic doctor. Okay, your these things can be well taken care of. Yes, Cynthia, I guessed so that, and I've already typed it in. Okay. Which foods lubricates joint, excluding dairy? Anything which can increase the kapha. Okay. Uh, I don't know why you want to exclude dairy. Okay, probably you might be somebody who's not taking anything dairy, right? So anything that can increase kapha, anything sweet. Okay, even rice for that matter. Okay, rice can increase the quality of your joints. Okay, sesame oil. If you're looking at sesame oil, consuming sesame oil 1 teaspoon in the morning and 1 teaspoon in the evening, once it goes inside your body, okay, slowly over a period of time, it will start lubricating your joints. But still, you have excluded dairy. I would say ghee would be the best thing that can lubricate your joint to the best. Okay, other medical preparations, medicine preparations also there. Dhanvantaram Thailam is there. Okay, where we have potentified it multiple times, 101 times. All those things will directly help lubricate your joints. I understand, myself and my husband are medium built, but my children are not putting on weight. See, just because you and your husband are medium built doesn't mean that your kids have to be medium built. Probably you were thin or your husband was thin when they were also of this age, maybe marriageable age, and you would have put on weight off late. Or they would have taken from the grandfather or grandmother or the uncle or auntie or from somewhere else. Okay. So I don't want you to force them to put on weight. If you force them to do something where they put on a lot of weight, then probably that will be a deviation from their natural prakriti. Okay. And then they might fall sick. So if the most important thing is to see whether they are healthy. If they are healthy, let it be. Okay. I want to commute to my work by walking. I'm a person with desk ridden work, but 5 kilometers to and fro results in 10. Is this risky? I don't think it is risky. It again depends upon your strength. Okay, if you are not, but one thing is that I would say is if you're walking to your office in your chappal or your office shoes, that might be risky for your legs. I would say you can carry a sneakers or walking shoes, wear that and walk. Once you're in office, you can put it back in your bag, wear your office shoes. Again, when you're coming back, it's always good for you to wear the proper shoes when you're walking back. 10 kilometers per day is not at all a problem. Okay. I don't want you to overdo it. That's it. Okay. Don't, probably don't do too much of brisk walking. Decent pace walking, it's not a problem. 10 kilometers is not a problem. How long will it take for 10 kilometers? Might be about 1.5 hours. So 45 minutes morning and evening is not a problem. Okay. What's your view on oil pulling? Should it be done before or after oil pulling, or gandusha is actually a nice thing. Kabbalah, it is very good to lubricate your eyes, your ears, your nose, your gums, your teeth, strengthen all those things. Very good. Okay, so this is something which you can do after you're brushing your teeth, after your gargling and all those things. You can do oil pulling. For oil pulling, okay, you can use simple sesame oil. That is more than enough if you don't have any issues. Okay. Does dry dates and wet dates have different properties? Not exactly. Okay, just because it dries doesn't make it different. But if you look at the quantity, what happens is, what the only thing that is lost when it becomes dry is the water part of it, generally speaking. So by and large, when we make medicines here, okay, when date is a part of it, normally it is very difficult for us to procure so much of wet fresh dates. So dry dates is also can be used in medicinal preparations. It need not be fresh, so properties are basically the same. When shall we drink water after getting up in the morning, before brushing or after brushing? I would say, Pragati, look at this way. If you have brushed your teeth really well before going to bed at night, okay, so when you get up in the morning, you might not have too much of whatever it is, dirt in your on your teeth or in your mouth. Okay, so you get up in the morning, gargle it once, you can run your finger on your teeth, and then you can drink water and you can brush later. Or if you're not somebody who's brushed at night, I would say it's always better to brush your teeth before you drink that water. That's all. But I would say that you have to brush your teeth before you go to bed. Yeah, most welcome, most welcome. 1.5 year, I met with an accident. Left leg tibia bone has been operated, but now I'm having pain in right leg. I personally feel that the reason for the pain in your right leg is because when you had that left leg pain, you would have given a lot of strain on your right leg to walk or for all your activities. You have to do strengthening of both your legs. Any fitness center, any gym, I would not say you have to do too much, but you have to do strengthening of both the legs. And did you put on weight after you have broken your tibia is another question. Okay. Yes, 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 yes. Yeah, 70 is a good number. Okay. So probably we'll touch 100 and then think whether we have to go ahead or not. Okay. So another 30 weeks to go. After that, let us see, we can take a break, or probably if things are all good, we can directly go to questions rather than talking about a topic. Just open up and start questions. That also is actually fine. Okay, yeah. Bathing in cold or hot water is good. Bathing in cold water during summer is good, and bathing in hot water during the colder season is good. But either way, pouring hot water on the head is not good. Okay, even if it is cold season, I would say don't pour hot water. Go for slightly warm water. Okay, not hot water. Need not be cold, freezing water. Okay, go for warm water on the head and never hot water on the head, because hot water on the head is not good for the eyes and the hair. For the body, you can use hot water. Okay. What's the next one? How to maintain dense hair? Is oiling daily required? For a person, for me, I have got decent hair. Looking at my age, I've been oiling my hair almost daily for since childhood, and you know, I would say, there was a dip in my hair quality when I was probably when I reached the 40s, and that is when I decided to, you know, create something for myself, and it really worked well. Then I gave my friends and all those things, and really started working well. So you have to, I would say, if you look at the nourishment which the scalp gives out, look at that. Okay, it is oil basically, it is not water. Okay, so the scalp of the hair is something which identifies a lot of nutrition through oil. That's why Ayurveda specifies that for best hair, the base of whatever medicines you use should be oil. So oil, when you see a lot of water-based serums and all those things, but in my opinion, anything which is oil-based works better than water-based. But you should use the right kind of oil. Most welcome, KBK Hemvaidya. Yes. Then what is the concept of taking stale saliva inside, which is supposed to be extremely potent to kill? Pragati, I don't have, we don't, Ayurveda doesn't believe in that concept of taking stale saliva inside. Okay. I don't think it is capable of killing any bad microbes in the body, because if you don't brush well and the saliva is there, saliva contains a lot of bacteria. Okay, that's what, if you have not brushed your teeth really well and you've got food lodged in your teeth, it is the same bacteria which is in the saliva which actually decays your teeth and causes infections. Okay, so just, I've heard people tell, if you put a rice in your mouth and sleep, get up in the morning, and you take that rice and feed a hen, the hen will die because it is that poisonous. I don't believe in any of those things. Okay, I would say brush really well. Yes, Pragati, I think I just answered that. It is not. I don't think it can. It can. It is supposedly a potent medicine. It's all His grace. It's all blessings of my elders, gurus, and ancestors. Okay. I am also feeling extremely happy that I can spend this time with you people. Okay. Please continue with same style of your program. Start with topic, then questions. Okay. Okay. Sure. Sure. Okay. So we are slowly coming to the end of today's thing. Yeah. Most welcome, Pragati. 70 episodes returning AMA into amazing insights since day one. Thank you. Yes. Okay. Yeah, Ayurveda related Q&A is also a good idea. So let us see. Probably the topics might be different. We'll think of how we go ahead. But I do want to continue what I'm doing. Okay, so let's see. Okay, so thanks a lot. I will see you next week with another topic, and then we'll discuss something. Okay. Okay. Namaste. Good night. And tomorrow is Kartika Deepam, right? Full moon. Enjoy. Okay. May all your lives be filled with light. Good night.